Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
just launched by an East Bay fertility doctor.
Hi everyone, thank you for joining me on tonight's Egg Whisperer Show. I'm Dr. Amy, fertility expert in the San Francisco Bay Area, and I'm super excited to have Dr. Felice Gersh, PCOS fertility expert, on the show tonight from Irvine, California. Hi Felice, thanks for joining us tonight.
Oh, it's my pleasure. I'm so excited to be here with you.
Thank you. The topic of tonight's show is PCOS SOS, and that's because Dr. Gersh is a world expert in PCOS. She travels internationally talking about what she's learned over the years about PCOS. Tell me a little bit about your book, PCOS SOS.
Well, it's really a long labor of love. It's based on many years of experience and many, many hours just digging through all the world's literature on the subject and related subjects. So what it is, it's a 7-step program designed to help every woman with PCOS to optimize her health so that she can lead the life that she deserves. It starts off and it goes into a deep dive into the science of PCOS. Like, what is it? Why do women have it? How did they develop it? What are the symptoms and the signs, the manifestations? And then it really focuses on what you can do, practical ways to really turn things around, because women with PCOS really have some of the most challenging issues in health to follow, to really overcome.
And you're way ahead of your time. I mean, you've set up your practice in a way that doctors are only starting to do today. And you know, you're board certified in OBGyn and Integrative Medicine. So tell me about how those things come together for your patients in your practice.
Well, women with PCOS have so many challenges. It really takes, I say, it takes a village to really help them. So I am really the captain of the ship in terms of their health care, but I can't do everything. I can't be everywhere. So what I have done is create really a program that incorporates many, many other healthcare providers. So I have in my office a marvelous naturopathic doctor, and she specializes in helping with nutrition and gut healing, which is hugely problematic for women with PCOS. She also specializes in dealing with acne and facial hair, hirsutism, and alopecia, the hair loss that so many women with PCOS suffer from. And we do what's called platelet-rich plasma, and we have for both skin and for hair. We also do some high-end types of peels that help women who have terrible acne scarring, discolorations, and also, of course, active acne as well. Mm-hmm. So we have all of the skin care, we have the nutritional care, and then we also I have a PA and I have a nurse practitioner and work with stress, because women with PCOS deal with so many issues of stress. So we incorporate meditation, essential oils, aromatherapy, guided imagery, so breath work, so we can help women to deal with stress, and of course that leads into sleep and sleep problems. And then we have a gym in my office, so I have a fitness specialist who deals with body composition issues, fitness assessments, and then exercise prescriptions. And then in addition, because women with PCOS come in all different ages, many of them are younger trying to get pregnant, but they age like everyone else. Mm-hmm. And cardiovascular issues are a big issue for women with PCOS. They tend to have much higher rates of diabetes and hypertension. So we incorporate vascular scanning so we can see the health of their carotid arteries and see how their hearts are doing and so on, to make sure that they do not succumb to any of these issues. So we have a whole array. In addition, I have a fabulous massage therapist that does body work, that does craniosacral massages and myofascial release, because women with PCOS have a lot of musculoskeletal problems as well. Mm-hmm. And so we cover the whole gamut of issues that women with PCOS face, so that we can really, like I said, optimize their health and their potential for a happy life.
So what you're describing is so many cutting-edge treatments, and I don't know that there really is a clinic anywhere in the world that offers this type of care to PCOS patients. So if someone can't see you in your clinic, they can read about all of this in your book, right?
Right. I would love to have every woman with PCOS be able to see me. But of course, I know that people live in different places, even around the world. I get emails from women on every continent, excluding Antarctica, literally every continent, because PCOS is an international problem. It's a global epidemic. Right. There is not one country that doesn't have a growing and very significant incidence of PCOS. So yes, to help really fulfill my mission. I really see it as a mission in my life is to help women with PCOS around the world. That's why I had to write this book and my sequel book that I have coming out and more sequels after that, so that women with PCOS have access to information, because it's so hard to get really good information, to get really good tools, because sadly, so many wonderful doctors that mean well, but they keep doing the same old thing over and over, which doesn't work. And we know that that's the definition of insanity. It doesn't work. And I go to conferences where they even say, verbatim, it doesn't work, but they don't have any other tools. That was why I went into integrative medicine, to expand my therapeutic toolbox, so I can actually offer things. I can't just be, the hammer nail thing, so everybody gets the same birth control pills, metformin, spironolactone, even though they don't address in any way the fundamental issues that women with PCOS are really dealing with within their bodies. Those are, at best, superficial ways to deal with some symptoms, at best.
And this passion of yours to educate women all over the world about PCOS, is it personal for you?
Well, it is personal as well. Like so many people in medicine, we're attracted to something, not opposites, but similars, right? So I did not know what was wrong with me. I had no idea. And all I knew is that my periods never became regular. And then when I was in medical school, I went 2 whole years without a single period. And I was now into my 20s, and I could never get rid of the acne that I had. And I went to the dermatologist at that time, and nothing was helping. And it was very distressing, to say the least. Women, the first thing that we look at when we see ourselves in the mirror is our skin. And then second is our hair, So PCOS women get affected very terribly with both in so many cases. And so I went to one of the very top, highly respected OBGYNs at the department of my medical school, and he just totally brushed me off and said, so what? Women don't even like having periods. Just go on birth control pills. And I said, but I want to have a baby, and not right now, but in the, after I finished medical school, because I was already married at that time. And his response was, oh, just go on fertility pills when that happens, when you want to get pregnant, which is what happened. I had to go on fertility pills because I didn't know what else to do. And, and I'm not against fertility pills, but even if you use them, like I went on the clomiphene, you want to be healthy before you even start that process, because we now know so very powerfully how the setting in the uterus really epigenetically modifies and really lays the foundation for the future life of that baby. So no matter what pathway a woman goes, if she has to have IVF, if she has to have fertility drugs, we want her to be optimally healthy before she even gets into that process.
Right, I call that trimester 0. That's one of the most important trimesters, and we don't talk about it enough. So you just had a book launch. Congratulations, your PCOS SOS Fertility Fast Track on Kindle, for those of you who want to get it right now. And I think the print version, the hard copy, is coming out soon? Right. So here is my first book, the foundational book, PCOS SOS. And that's a gynecologist's lifeline to naturally restore your rhythms, hormones, and happiness. And here, what I'm going to do is I'm going to have a series of fast track books. And what makes them a little bit different is, and here's the new one that's coming out very shortly. And so this is the 12-week plan to optimize your chances of a successful pregnancy and a healthy baby. And what it is, it's a 12-week plan. So it tells you week by week for 12 weeks exactly what to buy. It has shopping lists, everything, like from A to Z, what to do, so that if you're in a rush, you're ready. You want to get healthy, you want to have a baby, but you know that you have to do that trimester 0, that is so that's what this is about, to make you really as fertile and healthy, because they're the same. This is so poorly understood, and even in the gynecological world, that fertility is a vital sign of health. So we want every woman
to be fertile, even if she doesn't want to have a baby, because that's a sign of health. But when you want to have a baby, it certainly is essential. So we want to optimize health before we even try to get pregnant, and then you will have a much better chance of getting pregnant and having lower pregnancy complications. Women with PCOS have among the highest rates of pregnancy complications, miscarriages, gestational diabetes, preterm labor, preeclampsia, all of the, and even malpositioned babies. All of these things, abruptions, all complications are much higher in women with PCOS. By getting women healthy and fertile so that they can naturally get pregnant, or if they do have assisted reproductive technology involved, they will have a much more successful time of it, and they will have a much less complicated pregnancy and deliver what they want, a beautiful, healthy baby.
That's definitely the goal. So I want to kind of transition because I want to take advantage of your wealth of knowledge, because not only do you specialize in PCOS, but you're also an integrative medicine specialist. And there's some things that I just don't know. And so I was reading that you're also a specialist about CBD and CBD oil and its uses. Can you tell me more about that?
Oh my goodness, it's such a new way of looking at the human body. It wasn't very long ago, like before 1990, we didn't even know about the receptors for the endocannabinoid system. So we have this amazing complex system in the body that has been named the endocannabinoid system. And it's sort of a case of reverse engineering, because we discovered as humanity, like thousands and thousands of years ago, the potential benefits of the plant cannabis. And then they discovered, oh my goodness, humans have receptors that can interact with the plants, with components of the plant. So they named our system after the plant. So it's endo for within us, cannabinoid based on cannabis. Well, it turns out that this system is very interlinked with fertility. In fact, everything about reproduction is linked to the endocannabinoid system, like everything. In fact, how the egg develops, the health of the egg, ovulation, how the egg gets transported down the fallopian tube, enters the uterine cavity, implants into the uterine wall, the whole, everything in pregnancy, and ultimately the actual going into labor and delivery is all related to the endocannabinoid system. And there's a bidirectional feedback system between female hormones, estrogen and progesterone, and the endocannabinoids. Well, it turns out that in many women, unfortunately, there's a dysregulation, a poor functioning of the endocannabinoid system, often an over amount of production of endocannabinoids, and then resistance of the CB1 receptor. Well, this can create all kinds of metabolic havoc in a woman. And of course, women after menopause have many, many problems relating to osteoarthritis and osteoporosis and sleep problems, mood problems. Well, it turns out that these magical components that are in the plant cannabis can interact with our own receptors and can help to balance out this dysregulation, or when you have deficiency of endocannabinoids, which can also happen with aging. So the potential is phenomenal. But most of what the work that I deal with is with hemp-based cannabis, because hemp has an array of, at least 100 different compounds that are in the plant, not just CBD, but there's a whole array. And when they work together, they call that the entourage effect, which actually magnifies the benefit, exponentially. So there's research coming out, and of course we need much more. But there's actually there's some articles showing that PCOS is actually manifesting a dysregulation of the endocannabinoid system, because a lot of times when you have metabolic syndrome, that is an upregulation, an overproduction. So I've been starting to use, and it's really just sort of trial and error, but so far there hasn't been really much error. I'm getting good results in some women, that not when they're trying to get pregnant, but at other times to deal with a lot of their manifestations. And I'm getting good results, really good results for menstrual cramps, for PMS, mood disorders, I think there's going to be a potential to help with insulin regulation, fatty liver. There's actually some published literature now that it might help to counterbalance and maybe reverse fatty liver, which is an epidemic, and especially in women with PCOS. So I am extremely excited. I'm also looking into using more of these products for vaginal health, an area that is so incredibly neglected. And the vagina is not just a tube, for babies coming out and for, men coming in. It's not. Right. It's way more than that. It has its own unique microbiome, and so does the cervix, and so does the uterus, and ultimately so does the placenta. Nothing is sterile, and we have done a lot inadvertently to harm the health of the vagina. So I'm hoping too, by using some of these products, including CBD and other hemp-based derivatives, that we can actually help restore the microbiome and the health of the vagina. And we're going to be doing some studies on that. But for women who have dysmenorrhea and pelvic pain, which is so epidemic, interstitial cystitis, chronic pelvic pain, endometriosis related pain, that using hemp suppositories, I'm getting really excellent results, and more literature and data will be forthcoming in the near future. So I'm really excited about this new, really a new horizon, a new potential for women to have really helpful solutions to problems that really up to this point have had no really good solutions whatsoever. I mean, what do we do for endometriosis? Get rid of their hormones? This is not, that opens up such a Pandora's box of horrendous metabolic problems, mood problems. So if we can control it, in fact, we now know that with endometriosis, which is a huge problem for about 10% of women, maybe more, that it's actually a problem involving the endocannabinoid system. They have progesterone resistance of the progesterone receptor, which seems to be induced by early exposures in genetically prone people to pesticides like dioxins. And so the progesterone, when it gets high in the second half of the menstrual cycle, the luteal phase, helps to upregulate the receptors on immune cells, like mast cells that are circulating in the pelvic cavity, to calm them down. So when you get the products of the uterine cavity, the retrograde menstruation, where you have the dead, dying tissue from the uterus, and some of it goes backwards, like backwash, retrograde menstruation, and that's normal. But the body has innate mechanisms to deal with that, and it calms down the immune cells so they don't explode like the way they normally would when an invader, like a bacteria, comes in. But that's not happening in women with endometriosis. So by trying to override that resistance, that's what we do with receptors, right? We give more, and we can override that resistance by giving more of this exogenous cannabis product that can bind to the receptors. We have the potential to calm down those mast cells, which are really the etiology of this whole inflammatory cascade that happens in women with PCOS, with endometriosis. And by calming that down, we can perhaps early on in the whole development of endometriosis, keep this whole system calmed and all these problems at bay. And so I'm really excited with the future for women with endometriosis and using hemp-based cannabis products.
That's amazing. I mean, I imagine that you're a leader and everyone else follows, because I'm just listening to you speak and I just feel your energy, and I feel like so stupid, honestly. Because you're just, you're opening my eyes to so many things that I never even thought of for my patients. Certainly, we don't recommend CBD in fertility, and there's so much more work to be done there, but for endometriosis and PCOS, so especially for my California patients, I'll be asking them to follow up with you through your telemedicine consults that they can do to figure out exactly what the doses are, what actual CBD oils you recommend for them. So thank you for sharing about your experience. I wanted to talk to you a little bit more about fasting. We talked a little bit about PCOS and diet. What do you think about this fasting trend?
Well, it's sort of a new trend that's a really old trend, right?
Yeah.
Because when you go back into the history of humanity, we evolved during times of feast and famine. There were more famine days than feasting days, I'm afraid. And so we evolved to live in that state, a state when we sometimes didn't have food. So our bodies developed incredible mechanisms to deal with that. So when you are fasting, and I don't mean for 1 day or even 2 days, I'm talking about at least 3 days to 5 days.
Yeah.
And there's a way that we can work around that with the fasting mimicking diet. But if you are fasting for 1 day, the body says, well, I'm going to burn some calories and I'm going to hang out. If you burn after about 2-3 days, once you get certainly into 3 days, the body says, you know what, there is no food coming from the heavens. I better go out and find some, because I have only a small window while I'm still strong and I can go and get food. So the body does what it should do. It sheds off crappy cells. So you have programmed cell suicide or apoptosis. So crappy cells, old senescent cells, potentially cancer cells, they kill themselves off. And then you have the good cells, and they go through what's called autophagy. So they recycle their internal components like membranes and organelles, and then they put them in the lysosome, I call it the recycle bin, and then they spew out amino acids and fatty acids, and then they reconstruct all of these structures within the cell. So it's like a total intracellular rehab, and those cells will then live longer. Right. Now, one of the things that defines our potential for longevity is how many replications of cells we can have. That's why a dog, no matter how well you take care of them, isn't going to be 50 years old. And no matter what we do, we're not going to be 200 years old, because certain cells in the body, they reach a certain number of replications, and then they can't, when they die, they can't replace themselves. So if you can get cells in the body to live longer and better, then that, of course, opens up the potential for a longer health span.
Got it.
And they've actually shown that in mice, not in humans, because we don't have human data along that. But let's, even if we forget the longevity part, you have now revamped your body. It's like a reboot. So you have healthier cells, you get rid of the junky cells. They've shown that you can burn liver fat off, so the fatty liver gets burned, and you reduce inflammation. And of course, when you reduce inflammation, you normalize your insulin levels and so on, because inflammation causes insulin resistance. So, you know, everything kind of gets better. People can lose weight. They feel better. It increases brain-derived neurotrophic factors, so brain growth factors increase. So people feel calmer, happier, and smarter. And they've shown in animals that they actually run mazes better, you know, so they really are actually doing better. Their brains seem to be working better. So I think there's a definite place in most people's lives. There are a few exceptions, you know, people who are very elderly, frail, very, you know, ill, and so forth. And of course, women who are pregnant, that's how, or nursing. But in the vast majority of the population, especially those under age 65, are typically excellent candidates to do some fasting. And I used the fasting mimicking diet mainly because it really gets hard to get compliance when you tell people to stop eating on even an intermittent basis, like 3 times, 4 times a year, to stop eating for 4 days in a row. It's people just, they don't do it. So that's why, you know, at USC, they developed what's called a fasting mimicking diet, which is really brilliant, where they designed food for 5 days that flies under the nutrient sensors in the brain. So I call it stealth food. So you get to eat, but your body doesn't see it. So because it just doesn't have enough protein, because protein usually works with the receptors called, you know, with mTOR. So it just keeps that quiet. So the body doesn't realize you're eating. Now, of course, that's not a ton of food, because there's just so much food you can eat and your body still thinks you're fasting, but it's enough to get through 5 days. And you get a nut bar, and then you get soups for lunch and dinner, and little extras like olives or kale crackers and such. And so I can get good compliance this way. So, you know, it really helps people who have metabolic issues, so it helps with that. And I'm using it with my PCOS patients with excellent results, and we're hoping to do studies on women with PCOS patients. And and then, of course, there's other forms of fasting. There's intermittent fasting, so that's called prolonged fasting. Intermittent is where you would stop eating altogether, except for water or maybe a few calories, but always less than 500. Maybe some people use 300. And they try to emphasize using fat calories to keep your insulin levels down. And you do that for 2 days a week. And when they've done studies on that, people lose weight. And when you lose weight, you lower inflammation, you improve insulin sensitivity, and so forth. The problem with that is really hard to get people to do that for very long periods of time.
I was going to say, how long can you sustain 2 days a week of fasting?
Very few people can do that. Really highly motivated people will do it for, you know, maybe even a year. But it's hard to sustain that. But whereas doing like a fasting mimicking diet, like 3-4 times a year, is much more manageable for most people. And then there's what we call time-restricted eating, which some people mix up with fasting, because anytime you're not eating, you're technically fasting. But they came up with these names. Time-restricted eating, which is so important. And I emphasize this as well with all my patients that have metabolic syndrome and, of course, PCOS patients. And that is that we are really controlled by clock genes. We are time creatures. We are circadian. Based on the 24-hour rotation of our planet, And so basically, we are designed to be day creatures. That's why we are diurnal, we are not nocturnal. So what it turns out is that our insulin function, our insulin receptors are much more functional in the early part of the day, the first half of the day. So when we eat in the morning, our bodies deal with the food much better. And the muscle takes up the glucose much better. Everything, all the metabolism, everything is working better. So, and in our society, a lot of people are night eaters. And just eating healthy food at night is going to harm you. You will be more insulin resistant, more prone to all kinds of cardiovascular ills, metabolic problems, weight gain. So they've done so many studies now. This should not be controversial, but yet in spite of all the data, there were so many people that say, I'm fasting, and they fast from sometime in the evening until early afternoon. And that is wrong. It's not, you're doing it at the wrong time. It's not just fasting. You have to fast based on the way our metabolic systems are set up. So what you should do is get at least a 13-hour fast, and after that, it's little return. But you can do more than 13 hours, but just aim for 13. That's hard enough for most people. So from dinner, which should end ideally by 8 p.m., even 7 p.m. is better, and you wait 13 hours, and then you can start eating again. And you should eat within a couple of hours of getting up in the morning. And then you can get that's your time-restricted eating when you're fasting during the night. And then you have a good-sized breakfast, and then you can either have, a medium lunch, a medium dinner, or when you get more advanced, you can have a bigger lunch and then no dinner or tiny dinner, but most people won't do that. So we compromise and we say, have a big breakfast and then a supper, sort of an early dinner and maybe a tiny, tiny little lunch. We try, obviously people's schedules are going to make that hard sometimes, but try to aim for that because they've done studies. You eat in the morning, you will lose weight. The same food, you put it at night, you'll gain weight. It's not just calories in, it's how you burn those calories and your metabolic function. So that's the whole thing of time-restricted eating. And then stop snacking. That's really important because you can't set the beat of all your clock genes in the periphery, including your liver, if you keep snacking. So I know that was well-meaning, but stop snacking.
Well, Felice, I had so much fun with you on this show. I would love to invite you back. I mean, we talked about so many things. We talked about PCOS, fertility, CBD, fasting, and I feel like there's so much more we can talk about. I was hoping that we could also talk about sleep tonight and the circadian rhythm a little bit more, but just to get your thoughts about it. But I'd love to do a part 2 episode together with you. I'd love it. Thank you. Can you just show us your books again before we close off tonight's show? I just want to make sure everyone knows how amazing you are and what an incredible, we're just so lucky to have you as an OBGyn and integrative medicine board certified specialist. Here we have the PCOS SOS book you guys can get now from Kindle, the PCOS fertility track book available on Kindle. Her SOS book is available on Kindle and in hard copy as well. Thank you, Dr. Gersh. We love you.
I'm trying to get it right.
You just, right, Paula? I mean, just amazing. And we hope to learn from you for such a long time to come and can't wait to have you on the show again. Thank you so much for all your work. Thank you for what you're doing for women and how you're really talking about cutting edge stuff that people out there haven't even heard about when it comes to PCOS or endometriosis. So I'm hoping by people listening to the show, if you can't see Dr. Gersh, that's okay, but maybe you can find a naturopath or specialist or OB-GYN in your area that does take care of women in this holistic, wonderful way. Thank you, Dr. Gersh. Thank you, everyone, for watching tonight. Hope you'll join us next week, and we'll see you back here soon. Have a great night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.